I just want Dr. Juliet to talk a little bit about medicine and the value of medicine in dealing with mental health. Dr. Cox already highlighted to me in the comments that, you know, there's a bit of a difference in what works here and what people are trained in America, because the population is mostly Caucasian. So just integrating like the value, and then when problems arise, how we can deal with them while we are here in America.
So do you want me to speak on the role of medications?
Yes, the role of medication, and then sometimes why it doesn't work out well, or what goes wrong, and how we can deal with that as well.
Okay, so I think, you know, a lot of what we have been talking about falls more under wellness and maintaining health. And I highlighted earlier, you know, when something becomes a disorder. And so I think the lens with which I'm seeing things, I'm seeing the really ill. Okay, I'm seeing, you know, schizophrenic who's constantly hearing voices, who's delusional. I'm seeing the suicidal patients who've had multiple suicide attempts, a bipolar patient who's been up and not making sense. So, you know, medications work. In those situations, medications can help to reestablish mental stability so the patient can function, live at home, live in the community, hold a job, some very basic things that we want patients to be able to do. Because when the disorders get to that point, they're not even able to do that.
Mm-hmm.
And so, you know, yes, there are side effects. You know, we discuss it with patients if they're able to even engage in a discussion of risk benefits. Otherwise, we're discussing it with the families. And then when they get better, you know, then we start working with the patient and working for them to develop some insight into, you know, what's going on with them. What is the role of medications in their overall treatment plan? Because otherwise you're going to deal with this revolving cycle of, you know what, I'm feeling better. I don't need this.
Yes.
You know, because I don't like this side effect. I'm gaining weight, or it makes me too sleepy. And so then they get off and then they're back in the hospital. So there has to be the buy-in on the patient's end as well. And that comes from working with them to develop some level of insight. And so, you know, some people, you know, think psychiatrists are all about pushing pills, but it's really about coming up with a treatment plan that works best for the patient. And for a lot of disorders, anxiety disorders, depressive disorders, medications is only one arm of the treatment. We talk about biopsychosocial, spiritual formulation and treatment plans. The biological might be medications. The psychological might be psychotherapy, CBT, DBT, or, you know, what have you. The social aspects, encouraging social support. The spiritual aspect if the patient is so inclined. But taking that holistic approach and you know, making it clear to the patient that this is just one tool out of many tools to help you to do well. And then we can work with side effects. Tell us what's going on. We have a lot more medications in our armament and options that we can choose from. So if one's not working or it's causing you problems, speak up. I want to know about it. And then, of course, monitoring labs and things like that to make sure that they're doing well.
All right. Thank you so much. I think that is valuable information. Medicine can help you, but you need to combine everything. And I think you highlighted that self-awareness is a bit important. If your patient is so sick that they cannot even be self-aware to be able to recognize the side effect versus their own symptom of the illness, then, you know, it's going to take a little bit of time before you can have that back and forth conversation. And I definitely appreciate you highlighting again that the family is capable of, you know, being a part of this decision-making process if the patient is not able to make those decisions. All right.